Welcome to the Silicon Slopes Town Hall. My name is Clint Betts. It's incredible how this community comes together so quickly around important issues and around important topics. And I can't think of a more important topic or a more important issue at the moment than mental health and what I think has kind of been an epidemic or a pandemic of mental health within the Silicon Slopes community and even within our society. And I've asked a good number of folks to come on here and talk to us because they're doing the work. They're doing the necessary work to help alleviate this problem. And I think if we had an understanding of what was happening in this community and what everybody was doing already, and we could support those efforts, I think we'd have a good sense for how we might come together as a community, all of us, to solve this. And so to start, I thought I would bring on Dr. Jason Hunziker. He's the Behavioral Health Medical Director for the University of Utah to kind of kick us off around mental health, the state of mental health currently, what he's seeing, and kind of what he does over at the University of Utah Health. So, Dr. Hunziker, I'll hand it over to you.
Awesome. Thanks for having me. And man, I'm glad I get to go first because I see all these wonderful faces here. And I'm thinking, I want to sit back and listen because I know we're going to hear a lot of cool stuff. As Clint said, I am the Behavioral Health Medical Director for the University of Utah Health Plans. I'm also the Division Chief of Adult Psychiatry at the Department of Psychiatry at Huntsman Mental Health Institute. Been here seeing patients for over 20 years. And excited to see all these people come together and talk about the wonderful work that they're doing. So I thought maybe I'd set it up a little bit and say why this is so important. Mental health, as we know, we hear the word all the time, but I don't know that we know that how real expansive this is. I mean, 1 in 5 people in the United States suffer at any one time from a mental illness, with 1 in 25 having a severe mental illness, a serious problem that impacts everything in their life. That is why we're here. That's why we're talking about this today. And we're going to hear about the emotional and psychological and social toll that it takes on not only the person that is struggling, but on everybody that's involved in the community with that person. And it is a huge cost to the whole entire system. And I don't mean just financially. It is a huge cost to us in all of those other realms: psychological, emotional, spiritual, anything that has to do with communication and connection as humans. Mental health impacts, and so it's super important that we address this and we talk about it because it's a huge problem in Utah. I mean, I think we rank like 26th in the country access to mental health care. We can do better. We can do better than that. And we should be number one with access. We should be number one taking care of people who are very, very ill and people who are struggling with depression and anxiety. We rank in the top in the country in depression. We rank in the top in the country in suicide. We need to have more support and more services. And I think that's what we're going to hear today. And there's lots of reasons why we see this happen. We rank really high in having access problems, and we rank really low in the number of people we have to provide the care in this state. We have stigma, discrimination that keeps people from seeking out the services that they need. And so I think, again, this group that's here today is going to give us some great information about how to access that care and how to feel comfortable and be okay seeking the care that we need for our mental health disorders. With that, Clint, I think I'm just going to turn this back over and let the next person go because I'm super excited to hear about the rest of this program today. Happy to answer any questions later.
Thank you so much, Dr. Hunziker. It means a lot. I want, like, for the people who are listening and watching live and within the chat, which is doing really well right now. I guess, is that the way you would say it? It's just going crazy right now. Is it trending? I have no idea. For those, I think I should probably tee up who all is about to speak to us. Next, we're going to hear from Entrada CEO Adam Edmonds. Then we're going to hear from Allison Faust, who's the Suicide Prevention Program Administrator for the state of Utah. We're going to hear from Domo's own Nikki Walker. We're going to hear from Here Brotherhood's John Moore. We're going to hear from Vega Media Studio CEO Brandy Vega. Why is it hard for me to say Vega? That's crazy. We're going to hear from Share My Health CEO's Galen Murdoch. We're going to hear from Tava Health CEO Dallin Allred. We're going to hear from Kickstart General Partner Kat Kennedy. And we're going to hear from Brave Corps' Chris Deaver. I say all that so if you have questions for any of these folks, be thinking about them or put that in the chat and we will ask them. And with that, I will turn it over to my good friend Adam Edmonds, the CEO of Entrada.
Appreciate it, Clint. Clearly, I am the least qualified person to be on this town hall. But Clint and I are always texting back and forth about various things, mostly the jazz, but I'd say behind the jazz, the second most talked about topic between the two of us is mental health. We recorded a podcast with his podcast recently. It hasn't released. I'm already so nervous about it because I got way too vulnerable with him. But a lot of what we talked about is my own mental health journey over the past several years and what I've learned from it. The main thing being that taking care of your mental health is just like physical health. I'm a pretty active cyclist, and when I don't bike, I put on weight, I slow down. The same thing's it applies to your mental health. The thing I texted to Clint most recently a few weeks ago that was pretty alarming for me. Although it made a lot of sense when I read it. It was a study that Axios posted on Twitter. I'm just going to read you a few of the summary stats. It was a study of tech executives, so like VPs and above, but I don't think it matters that it's executives. I think this applies to anyone in tech. So Silicon Slopes, for the most part, serves tech companies. I think that's the vast audience. So, I think this applies to all of us. Let me just read you a few of these. In the study, 80% of tech executives report using a controlled substance and prescription drug, half of those people every day. 50% report being heavy drinkers, which is defined as 3 to 7 drinks per day. And 1 in 3 of us are using either an amphetamine or a sleeping pill daily to just get through work. Look, I'm just going to guess. This was a study not specific to Utah. I would not be surprised if the numbers are worse in Utah because for some weird reason, pills are more culturally acceptable here. But look, my message is these are hard jobs. Like Slack kills all of us. It makes it so that if we are awake, we are working. Personally, I've had the shit hit the fan a couple times in my career. And I often joke with friends that I don't really remember those times in my career because of all the Xanax that I took at the time. But as the CEO of a 2,500 person company, when I heard those stats, my mind naturally goes to how I can help create an environment that lessens the need, that kind of brings those numbers down. My personal journey, I've always thought I was immune to mental health, challenges. I never even thought about it. CEOs, good dads, good husbands, we have everything put together, right? The reality is that it affects all of us. None of us got through childhood without some sort of trauma, something we need to take care of. And maybe that pokes its head out in your 20s. Maybe it doesn't happen till your 40s or 50s. We've all got, unique challenges that kind of get us to a state that's not healthy. And I've got this really annoying personality trait where the worse I do, the more inward I go, and that begins my little death spiral. A few months ago, I posted something about this kind of Superman hero syndrome that I have, kind of detailing how I kind of have this spiral of wanting to be the hero for everybody, but when I can't, I really start to hate myself, and it puts me to this, place of resentment, loneliness. And in that post, all I simply did, and it was a little scary for me, honestly, I mentioned that I have a therapist and that I have an exec coach that I talk about different things with. And I was humbled and shocked. After I posted that, I got hundreds of notes, and most of them just thanking me for acknowledging that I talk to people. And that's probably my only message. And then I'm happy to shut up, but you've got to have someone, at least one, hopefully multiple people that you talk to. That's what I found is my secret to success. is you've just got to stay open, like going inward, going quiet, which, look, if you're a tech person, you're probably wired in a similar way to me, which is you don't want to show weakness. You don't want to put your stuff onto other people. And then on that same note, I've got a big group of people. I would challenge everyone on the call, make sure you're checking up on your friends, checking up on your colleagues. There's a pretty big group of people I try to check in on, at least once a quarter. It's usually just a text that says, hey, you good? And they almost always are, but once in a while. And there's one friend early this year, I'm glad I sent that text. You never know who's struggling, what they're struggling with. We all need help. Again, thanks, Clint, for having me on. This is a super important topic, and happy to be involved.
Can I just say that Adam Edmonds is one of my heroes? I think the way you've handled everything that's been thrown at you over the past few years, Adam, is so admirable, and the strength is incredible. But even more so for just coming on here and telling that story and saying what you just said, to be running one of the largest tech companies in the state of Utah, and to be that vulnerable to this community, and to be real with this community. I think that's super important. And so thank you. And you're a hero to me and a lot of other folks for doing that. Now we have Allison Faust, who runs the suicide prevention program at the state of Utah. You are not going to see Allison, but you will hear her. So Allison, take it away. You may not even hear Allison. We'll get this figured out. In the meantime, let's go to...
Are you able to hear me now?
Oh, here we go. Allison, go ahead. We can hear you.
Are you all able to hear me now?
We are, yes.
Okay, well, I needed to switch devices, so I apologize. Yeah, thank you all for being here today and talking about such an important issue. I am really excited to sort of transition and talk about some of the resources that do exist in our state here in Utah. So I operate as our suicide prevention administrator. Back in 2017, a bill was passed that required the state of Utah to hire a full-time person to administer suicide prevention programs in the state of Utah and really make this a priority. So in this role, I've worked with stakeholders across the state to actually put forth a 5-year suicide prevention plan that really does identify what the role that our businesses play, our healthcare providers play, our school districts play, and how we can each implement elements of this state plan and collectively reduce the burden of suicide together. So I co-chair the Utah Suicide Prevention Coalition, which is a great bi-monthly meeting that anybody is welcome to become involved in if they want to learn about different things happening in the state. We also have a variety of work groups that focus on different elements of our state plan. One of them that I think is really relevant to this group is we do have a work group that actually is designed to provide technical assistance and training to organizations across the state to implement policies, to implement strategies that we know are proven to reduce suicide in the workplace. And so this is something that I'm happy to help link you in with if this is something that you are interested in. I can put my email in the chat when I'm done speaking here today. One of the other things that I do, and actually how Clint and I got connected, was I oversee our statewide suicide prevention campaign, Live on Utah. If you guys are not familiar with this is Utah's first statewide suicide prevention campaign, really designed on educating the public on what their role is in suicide prevention. So helping people understand warning signs for suicide, what resources do exist, and how to have those tough conversations. And so in September of 2022, we actually launched the world's first ever suicide prevention training delivered entirely over Instagram. So if you follow @Live on Utah on Instagram, it's a series of 10 posts. You can take all 10 in probably less than an hour and become a Live On ambassador. And this training equips you with the skills to be able to recognize some of those warning signs for suicide and have those conversations. So we were able to host a launch event with Clint at Silicon Slopes and really kind of get this message out to people in Utah. We've had about 130,000 people complete all 10 lessons of the playbook in the last year, which is really exciting, and something that we could not have done on our own, teaching in-person classes. So I truly believe that technology is the way that we can help spread this message even farther. And so if getting involved with Live On Utah is something you all are interested in, we provide our materials free of cost. They've been designed by mental health experts in our state and can be shared in a variety of different media platforms, social media, billboards, whatever that looks like. And we're happy to share those with all of you. And then one other thing I just wanted to mention that we can offer in terms of support here at the state is if somebody loses somebody to suicide, there are ways that we know are helpful in a response and ways that will reduce likelihood of contagion. And so we want to help support organizations and communities to respond to these suicides in ways that is not going to increase risk for others. And so we do have a group of us that are helping organizations across the state put together these plans so that their organizations know what to do and how to support their employees. So kind of all across the spectrum, prevention, all the way to responding and postvention. But that's just a little bit of the landscape here. I'm actually at a executive committee retreat right now with a bunch of leaders in suicide prevention in our state, from our healthcare systems and our state legislature. And so this is a really timely meeting, and I'm excited to share what this group discusses further. So that's kind of what I had to share today. But I will put my email in the chat and would love to connect with all of you individually.
Allison, thank you so much. We'll make sure your contact info gets out to the broader community as
You're
well.
I think you're muted, Clint.
Oh, can you hear me now? Am I still muted?
Still can't hear you.
I'm muted, Weston. 1 second here. I don't know why I'm muted. Hey, go directly to
Can
Nikki.
anybody hear Clint? I can't hear Clint. Okay.
He's saying 1 second, I think.
Just go to Nikki, please. Oh, you can hear me. They can all hear me. It's just the Zoom call that can't hear me. Yeah. Interesting.
We can hear you now, Clint.
You can hear me now? Okay. I don't know what was going on. The YouTube chat could hear me, but you guys couldn't hear me, and now you guys can hear me. Incredible. Technology is incredible. Isn't it cool? We all work in tech, and it never works. Now I want to go to a good friend and another hero of mine, Nikki Walker from Domo, and we've just went through an experience in our community. I'm not asking you to talk about it or to talk about it, but Nikki, you have the floor.
Hey, everybody. So I am here because I want to help normalize seeking help for mental health. The experience that Clint is talking about is we lost a young tech founder to suicide just a couple of weeks ago, and had a memorial service for him on Sunday. It was overwhelmingly emotional. We all knew and loved him and understood the brilliance that he brought to the tech industry and to the world, and for his life to be snuffed out so unexpectedly for us was very challenging. One of the things I want to share, because a lot of you know me and a lot of you see me out and about in the world, is that I suffer from mental health disorders, depression, anxiety, and bipolar disorder, and PTSD. So it's quite the heavy load to carry. But every once in a while, it gets too heavy to carry alone. And just this spring, I made the decision, with the help of my village, including my therapist, to go seek inpatient mental health treatment. And I did so here in Utah, in Murray, Utah, at a place called Recovery Ways, which I will sing their praises for as long as I can. They saved my life, y'all. My depression had gotten so terrible that I was just in a deep hole that I could not get out of. And, when you get to that wall, you have to know that there are resources and that there are people who will help you. I do understand how difficult it is when you're in the middle of a crisis to try and take care of yourself. But that's the times that you need to try and reach out to those who love you the most. I also wanted to just mention, and I'm sure Brandy will as well, about resources. But I did a live last night on Instagram, and it is still on my Instagram page. And I would be honored if you would take a look. It talks about my journey with mental health and some of the solutions that we're trying to corral to make sure that people are aware of resources, people use resources, and people share resources. I saw a question in the chat a little earlier that said something like, how can we be confident that our jobs will still be there if we go seek attention for our mental health? And the first answer to that is when you take FMLA, the Family Medical Leave Act is here to protect you, to ensure that when you come back, you still do have a job. And, we are a group of people who are protected under laws. These are disabilities, mental health and physical health, run the gamut on disabilities. And this is, mental health disorders are one of them. So please inquire with your HR department about what FMLA could look like for you. Most companies in the Valley have some sort of psychological counseling through insurance that you can be a part of. So reach out to HR. The HR department is full of people who know what confidentiality is and are staunch supporters of confidentiality. So feel good about going to your place of business and talking through your needs, your health needs, because this is what this is. This is about health. And that's what I wanted to share. So thank you so much, Clint.
Nikki, thank you so much for again sharing with us, being vulnerable with us, and in particular, Nikki, I just want to shout out like you were the MC. I guess I'm not exactly sure what you'd call it for the memorial for GLAAD, and the strength and integrity that you showed during that. I mean, that was very emotional, and we'll all miss GLAAD. Yeah, it's awful. It's awful to still think about. With that, John Moore from Here Brotherhood.
Yeah. Can you hear me?
We can hear
Great.
you.
Awesome. You can hear me. Thank you first of all, for just letting us be a part of the conversation. I'm not certified in anything with mental health. I'm not licensed, but I do have a story. And I think that's the power that we all have, is the power of story and telling our own stories to be able to give permission to others. And thank you, Nikki, and others for sharing your stories about your mental health journeys and the ups and downs of that. And I think we can all relate to that. And all of you sharing it gives us permission to do that. So thank you. Well, Clint asked us all to share a little bit about what we're doing. And so a resource that we have created at Here Brotherhood is there's a few different resources or access to different resources, because we do believe in that accessibility, that it's important for those that don't usually have access based off of where they live or whatever circumstances. We need to provide access to those that can't access these resources. And so that's what we want to do, and provide a platform for those resources as well as a platform for support. And so what we've created at Here Brotherhood is an app. Now, going kind of just taking a step back a little bit, the research has shown that men are 3.8 times more likely to die by suicide than women. And obviously, we care about women as well. It's all important. We need to focus all of our efforts on both, but we have just felt called specifically to focus on the unique challenges and needs that men have, specifically when it comes to reaching out. I think a lot of times as men, we put our feelings down and we don't open up. And I think that has a lot to do with some of those statistics. I think it definitely informs those statistics. So I have a few good buddies of mine that have unfortunately died by suicide, and they were really big wake-up calls for me. But one of the key things as I've been looking at their stories and others is they had supportive families, they had supportive friends, and so that it just has racked my brain about how it's possible that that happens when they seem to have all of the support. And one of the things that somebody brought up to me months ago was sometimes we need a group of people that don't know our history, they don't know our story, they don't know our families, and providing spaces for us to open up in those kind of venues, in those kind of spaces. And there's a place for both. But that's why we created this app. We created an app for men to come and to be able to share, to open up, to get the support that they need, and also to offer support. But it's a space for men to share and to help others to know what they're feeling, and also offer that support. And so that it's a resource that we have found has been very helpful for hundreds of men so far. And we're new to this space as of just a couple of months. But the momentum from the app and just on the social media platforms, to see the kind of support that men are getting as they join this brotherhood of men, where they finally have permission to open up and to share, has been groundbreaking for some of them. And let me just, if I can, read a message I got just the other day from a brother who's on our app and who has been interacting with the other brothers. He said, "I think it is the one last prayer that the good Lord has answered for me in my recovery from almost diving into the abyss. Thanks for all that you do to help our wonderful community of brothers." And I can't tell you how many messages we've received like that, because of the support that they're getting from the brothers in this app and in this as part of this community, where other men have walked them literally from the edge of jumping in to the abyss and taking their lives. And so this is a resource that we want to offer to as many men as we possibly can, because we're seeing it work. Now, one of the things that is part of it that I just want to give a shout out to my partner Justin and Mike, they're both on here, is we have everybody sign an oath. And I know, Brandy, you do this with your organization as well, where there's power in giving people an opportunity to say something or sign their name to something that is seemingly obvious, but that we don't always do. And so part of our oath is basically sharing that not only will I reach out when I need help, but I will help those that need help as well. So it goes both ways, and it's a commitment to each other. It's a commitment to helping each other in our times of need and reaching out, like Adam was saying at the beginning, to reach out to each other when we're in need, and we all need that. So Justin, Mike, if you want to add anything, please do. But for those that aren't aware of the Here Brotherhood, we'd love to have you join our app. This isn't like a sales pitch. It's just it's a resource, and we would love to offer this resource to as many men as possible, because we're seeing it change lives every single day, and especially when we're able to see it go live in person, when we have events and retreats and hikes and breath work. Nikki, I think you were there for Mike's breathwork session the other day at Camp Convoy, and you can attest to how powerful it is to just go and face some of the things that and just our mindset, which is so helpful for mental health. So anyway, I appreciate you all. I appreciate all the things that you are all doing within this space. And I guess my parting words are this, that for many of us who come maybe from the business world or a business background, we think in the ways of competition. And the biggest epiphany in this space is that there is no competition. We are all in the same work. And if we can figure this out together and not compete, I think that's where the magic happens. That's where the miracles will happen, is if we all just come together and with all of our different backgrounds and experiences and just figure this out. So Clint, thank you for putting this space together for us to have that conversation. So thank you all.
John, thank you so much, brother. And for those
Can
watching,
I just have one thing? 10,
oh yeah,
15
yeah.
seconds?
Please go ahead. Let's get this on you here real quick.
Oh, you
Introduce
don't.
yourself
No one
as
wants to see
we
my
about.
face.
No, you're good here. Yeah. Let's add a word from another one from here, brotherhood.
Yeah, my name is Justin Bray. I just quickly wanted to add, I just loved what Adam said at the very beginning. He mentioned two things that really hit home for me. One of those was loneliness. That's really what we're trying to do when it comes down to the core of it, is to cure loneliness. That's really the space a lot of us eventually get into. That's what led me to almost taking my life, was getting to a place of utter and complete loneliness where you feel that no one is there for you or no one understands what you're going through. When we all know that there are hundreds, thousands, millions of people that can understand what we've all been through. And that's really what we've been trying to create in our community. He also mentioned just the simplicity of sending a text. When he said that, that's actually what saved my life from taking my own life, was receiving a text from my brother-in-law, and I was within seconds. It was right after I wrote a suicide note to my son. And so, man, just the simplest of actions can save a person's life. And yeah, I just really appreciate all of you guys here, and love what's going on. I love that more attention is being brought into the space. And yeah, just wanted to say thanks. So appreciate you guys. That was it.
Well, thank you so much for being willing to share that story and talk to us. And by the way, what a fantastic mustache you have, man! Like I've got to up my mustache game in order to compete there. Now let's go to
We can't hear you, Clint.
Let's go to Brandy Vega here. And Brandy, take it away.
Thank you for this opportunity. And John, I agree. My entire point has been, how do we create a community of collaboration? There's no competition in saving lives. I come from a point of lived experience. As a teen, I attempted to take my life, and I knew what it was about. I even got educated. I taught suicide prevention in the school with the former Attorney General. I worked in media for a long time. I'm an Army veteran. I joined the Army early as a broadcast journalist, and I've been in media and TV film for 28 years. I felt like I was pretty savvy in the world of mental health, but when my 12-year-old child tried to end their life, it really caught me off guard, and it was very devastating. And we almost lost her. And the first time it happened, we didn't talk about it because I was running my production company and my nonprofit, and I was single, and the stigma was overwhelming. And I thought, everyone's going to think I'm a failure. And how do you talk about this openly? It's too painful. And so we carried that deep, dirty secret for 2 years with a promise from my child that it wouldn't happen again. And thankfully, 2 years later, her friend had the courage to call 911, and police woke us up in the night, and we found my child before it was too late. When we got to primaries, they didn't even have a bed for her because they had had so many suicide attempts from kids 8 to 18. And I'll share with you that there's a new report that just came out that shows the suicide rate amongst kids has gone up 71% since 2010. That's 10 to 17-year-olds. When this happened the second time, I had volunteered. I try to do a lot of volunteer work in the community, and I had been working at the hospital at IHC doing spiritual care. Nobody dies alone. I'd sat with a lot of patients and held their hands, many of them by suicide, others with chronic and terminal illness. But as I sat in the parking lot the second day, not knowing if my child was going to live or die, I went to my feed. And it was the most vulnerable, hard video I've done in my entire life. But I got on my personal Facebook page and I just said, I don't know if my kid's going to live or die. If she does, I need help. Where do I go? What do I do? Some of you have been through it. Please help me. That video went viral. I had hundreds of messages in my account the next day. And I prayed the next day like you wouldn't believe when I got to Primary Children's. And I was shocked by the people who were struggling. Blew my mind. Beautiful, amazing, successful people. And mental health, suicide, it doesn't discriminate. Look at our group. young, old, rich, poor, black, white, doesn't matter. So I had a lot of messages. And when I went to the hospital, I was just praying to God, please save my kid. And I got the strongest message: you'll get a second chance, there won't be a third. What are you going to do? Because that video went viral, our mission, by the way, is we're like Live On. They've got campaigns. Because I do production, we're offering and providing hope, help, inspiration, support, and resources through media on a mass scale. We're bringing those messages to people wherever they are on the devices and platforms they use, through the people and companies they already know, follow, and trust. After my video went viral, because I worked in media, my friends at NBC reached out and said, hey, will you share your story on the news? I said, no way. No way. Too personal, too painful, too private. And again, we weren't sure if my child was going to come out of it. And when she finally did, I said, are you glad you lived, or do you wish you would have died? That's my child in the background. And I'm here at her college today. She lived, and she said, Mom, I didn't really want to die, but it was too late. And so I do this for all the people it's not too late for. We have tried to collaborate. We're working with Live On, we're working with HERE, we're working with multiple groups, the Suicide Prevention Coalition. So let me just finish so you guys can understand the magnitude of this. I'm so thankful that I have her in my life. I got a second chance. Not everybody gets that. And that's why I do this. KSL called, said, will you share? I said, no way. After she woke up, 2 weeks later, they called me back and said, nobody will talk about this, Brandy. It's a huge problem and nobody will talk about it. Will you please reconsider? And I thought, if I'm terrified to speak up and be vulnerable in front of people, and my background is in media, I was a reporter, I'm used to being in front of the cameras, I'm used to being an open book. What would a normal parent or person feel like? If not me, who? So I reluctantly did that interview on KSL. And I just said, if you're watching right now, stop what you're doing and go ask your kid point blank if they're suicidal. Honest questions get honest answers. Don't beat around the bush. And studies will back this up to say, when you talk about suicide, it doesn't trigger the idea. Either somebody is or they are not. So it's important that we talk about this. And after the story aired, I got a message from a father. And he said, you just saved my daughter's life. And I said, what do you mean? He said, I saw your story on the news. When you said those words, I ran to check on my child. I got into her room. She had already written a suicide note. She was in the process of trying to kill herself. We are at the hospital. Thank you. Shortly after that, we got another message from a family who said, thank you for being vulnerable. We saw your story on the news. We talked to our son. He confessed he had a plan this weekend to kill himself. We're getting him help. Thank you. That has led to this. We put on a big campaign last year. We bootstrapped it. It was called Live Live, and we provided the resources. We reached 160,000 people. We're doing it again this year, and we're filming it today. That is what we're filming, is our show. We are sharing 988. We are sharing NAMI, AFSP, Live On, JED Foundation, all of the resources HERE Brotherhood that we can find, because people need to know what's out there. I'm not trying to recreate the wheel. I'm trying to use my talents and skills and keep a promise that I made to God. If he saved my daughter, I would do anything he wants. And so we're putting this out. Our billboards went up yesterday, promisetolive.org. It's number 2. And our focus is this, kind of like the oath. We want everyone everywhere to promise, whether or not you personally struggle, that if you ever find yourself in that dark place, that you'll reach out to someone, anyone, a friend, a family member, a trusted resource, or call or text 988. 988 has been out a year, yet only about 18% of people know about it. 988 is the 911 for mental health, and we have to share that. Once people make the promise to live, we ask them to share it on social media. When you guys share your stories, when I shared my stories, we become, and as you know, Nikki, and everyone else who's talking about this, you become, Adam, a safe space. All of a sudden, people are okay starting a conversation with you. And when we start conversations, we stop stigma and we save lives. That is my mission. Stop stigma, start conversations, save lives. We're doing it on a mass scale through media. Our billboards just went up. We have PSAs. We're trying to get every company, CEO, influencer, celebrity to do it. On our show, we have John Boyd, piano guys. I don't know, we have 70 different speakers, survivors, entertainers, influencers. We're streaming this September 10th. I would love your help getting the message out. Our goal is to let people know they are not alone and there are resources. So this is our mission. This is our campaign. This is my passion. We have no funding. We have, we have no paid employees. It's all bootstrapped. I do this to pay it forward because I have my child that just tapped on the window, and I would pay any price for that.
Brandy, thank you so much for sharing what you just shared. Your child knocking on that door couldn't have been an accident at that exact moment. Thank you so much. That means that's incredible. And I just want to make sure that I put that out there again. It's promisetolive.org. And we'll make sure we promote the event, Brandy. But
Thank you.
Thank you so much. Now we're gonna go to Sapria Managing Director Chris Yadon.
Close, Clint. Close. Yaden.
Gosh, I
Almost
never
got-
do names right. Gosh, dang it. That's why I paused. I was like, I guarantee I'm gonna screw this up.
No one gets that one right. Well, thank you. It's so good to be here and share my different perspective around approaching mental health. What I would say before I get into that is, like you've heard from those who've gone before me, we all have stories. I won't share my story in depth because I think we've heard some amazing ones, but a lot like Brandy, the longest night of my life as a parent was in primary children's emergency room with a suicidal teenager. It's a horrific, devastating experience, but he chose to live and is healthy and now 26, married with 2 kids, working successfully, managing his mental health successfully. So, we can get, whether it's our kids or our coworkers or whoever, through these tough moments and help them live on. They can contribute so much to our state and our world. At Sapria, we exist to liberate individuals and society from child sexual abuse and its lasting impact. So when we talk about the lasting impact side of it, the most significant is later life mental health issues. So what I want to do is just share some data points that help you make the connection between trauma as a child or a teen and later life mental health, to go upstream a little bit to understand how those two intersect and help us understand that the only way we can really tackle mental health is to help our adults who have unresolved childhood trauma have the tools and resources to resolve that. And then just as importantly, and looking forward, investing in our youth and reducing the risk that they'll experience early childhood trauma. The stats I'm going to share with you are directly correlated to child sexual abuse, though you can infer them to other types of childhood trauma because there's a lot of similarities. I'll also, in the chat, as soon as I'm done speaking, just share some links to the research that I'm going to cite so that any of you that are data heads that want to dig deep can dig deep. So listen to these stats to truly understand the connection and the issue, at least one of the major drivers that's driving our mental health crisis. 85% of adult women who are survivors of child sexual abuse develop a diagnosable mental health disorder in their lifetime. 85% develop a diagnosable mental health disorder in their lifetime. Children who experience sexual abuse are at least 3 times more likely to attempt suicide later in life. Not to ideate on, not to think about, but to actually attempt suicide. They're 3 times more likely. Survivors of child sexual abuse report experiencing 14 or more days of poor mental or physical health per month. So when that unresolved trauma manifests as an adult, it's manifesting both in poor mental health and poor physical health. Youth who have been sexually abused are 5 times more likely than the general population to be hospitalized for a mental or physical health issue. One in 5 survivors of child sexual abuse develop an alcohol or illicit drug dependence by age 30. So you think about all the work we're doing around substance use, and we need to keep investing in that work. But substance abuse and use is almost always a secondary coping mechanism for an earlier childhood trauma. And we have to understand if we're going to address things like substance abuse in our society and its correlation with mental health, you have to go upstream and deal with the childhood trauma to truly resolve. Just a few more that I'll share. 28% of child sexual abuse survivors develop substance misuse, and 38% develop post-traumatic stress disorder. I will say that's what's diagnosed. I can tell you that almost 100% of unresolved child sexual abuse survivors experience post-traumatic stress symptoms, even if it doesn't qualify as a diagnosable disorder. As high as 66% of female inmates report being sexually abused as children. LGBTQIA youth are nearly 4 times as likely as their peers to experience child sexual abuse. And then the last stat I'll share, there was an amazing meta-analysis done by a group out of Europe that looked at the top 30 research papers done on suicide of youth between the ages of 10 and 25. And they were trying to deduct in this meta-analysis, what are the common occurrences that are happening that can help inform why our youth are experiencing suicide. Here's what they said. These are their exact words. Among youth aged 10 to 25, sexual abuse is the adverse life event most consistently and strongly associated with suicide. Our review suggested that sexual abuse, rather than physical abuse or neglect, appears to be more strongly associated with suicidal behavior, with sexual abuse being a particularly powerful predictor of several types of suicidal behavior in young people. And then they gave just a couple examples from some of the studies they looked at. The one that they first said is sexually abused boys had a 10-fold increased risk of making suicidal plans and threats, and a 15-fold increased risk of attempting suicide compared to those who were not abused. So why am I sharing these statistics with you? The old saying, it still rings true that correlation is not causation, but researchers know when you have correlations stacked upon one another and they're this deep and this intense, you have to pay attention. And it's not just child sexual abuse, and this is where I'll pivot a little bit from where my specific expertise is and say, unresolved childhood trauma is a major part of our mental health crisis. It's not the only part. Genetics play a role, chemical balances play a role, but it is a critical component and a major contributor to our adult mental health challenges that we experience in our workplaces. And as we consider solutions as a society, we have to go upstream and help our adults go back to their childhood and resolve that trauma if we truly want them to experience mental wellness. And in addition to that, we need to start getting ahead of it and start dealing with risk reduction for our children so that fewer children are experiencing childhood trauma. The last thought I'll share you is, what about Utah specifically? Sexual violence is the only violent crime where Utah ranks higher than the national average. Just this last year, the CDC reported again that 21.4% of our high school age girls report having been sexually assaulted in the last 12 months. I don't even know how to consume that information. We've got a major upstream issue that if we don't deal with it and deal with it in a significant way, we will forever be in crisis mode dealing with adults who are struggling with mental health. So with that, I'll stop. I'll make sure to share some of those data points and a few videos that highlight some of those data points in the chat so that you can consume them at your leisure. Thanks, Clint.
Chris, thank you so much. As a father with a daughter who just entered high school, let me say thank you for the work you're doing, and on behalf of all the parents as well who deal with this issue. It's important work that you do. Thank you so much. We'll make sure that we share everything you're doing widely as well. Now we're going to go to Galen Murdoch, who is the CEO of Share My Health.
So like many of you, I've built companies that value resilience and transparency. And I've smiled and I've said I'm okay when I'm not. My people followed that example. They're in pain like I am or was and am. They're scared, they hide like me. We need to take off our masks as leaders. Nowhere is this more important than in the workplace. And employers have an outsized impact and an outsized responsibility to help address the challenges that we're talking about here today. And it absolutely takes a community. Our ability to be real as leaders is absolutely crucial. Just to give a sense of the impact of mental health, to add to some of the stats that have been described, the WHO estimates that 12 billion working days have been lost at the cost of $1 trillion annually due to just anxiety and depression and missing work and the related performance thereof. That translates down to $46 million working days in Utah and a $32 billion Utah problem just on depression and anxiety. And that's just the impact to the workforce. Some studies show that a third, 1 in 3 of employees struggle with depression and anxiety. Only half receive the care that they need. And 1 in 4 have quit their jobs for the sake of mental health. Massive issues in retention, in productivity, and the impact that these issues have. If you boil those stats down further, depression and anxiety cost $250 per employee per month. That's the impact of that's how that $1 trillion boils down to us here in Utah, adjusted for GDP. That's at the average wage of $47,000 across the U.S. In Utah, we have a bit higher average wage of about 50, so that's about $275 per employee per month. If you've got senior developers or senior staff, multiply that. It could be $1,000 a month. It could be $500 a month easily per employee. Now, those are costs that as employers, we are already paying. And 65% of us work for a self-insured employer. And that means that they have a vested interest, even a moral and financial responsibility to do something about that. So as leaders, first and foremost, we need to take off our masks. We need to be willing to have open conversations, because that kind of culture that values being able to treat mental health with the same ease as we do broken legs and vacation days and dental appointments, that starts with us. I was at a conference last year, and the speaker challenged us to say, so how many of you, when you go to a therapy session, put on your calendar that you're going to the doctor? And I thought, ooh, as transparent as I try to be, I'm one of those. And so I've started putting, I'm going to therapy. I've started saying I can't go to that appointment because, but I can meet you an hour after that because I'll be at a therapy session. Or I just finished a therapy session and I'm raw, so go easy on me for the afternoon. It's going to take me till tomorrow to feel normal, if you will. And as we normalize those conversations in the workplace, it becomes easier for people to talk. It becomes easier for people to reach out to the very resources that we've been talking about today as a community, to avoid the tragic, shattering consequences of suicide, of depression, of anxiety, and a host of challenges that a third of us have. That means 1 out of every 3 of us on this call is struggling with depression or anxiety. And I'm among them. I struggle with depression and anxiety mightily. I'm, to Chris's points and his stats, I'm a survivor of 4 years of childhood sexual abuse. I struggle with PTSD, and it absolutely affects my day to day. And yet, by not keeping it isolated and secret and hidden, I'm able to better heal myself by sharing those ideas in the right time and the right ways, and share my own lived experience and journey. But even more importantly, create an environment where it's okay to do that. And as we've had a more open experience in our workplace, it's now really common to be able to say, like our leaders now do, and speak openly about it, to notice, to talk about it, and to act. And my call to action, my invitation in acting, is to measure what matters. Now, as a software company, we have a platform that focuses on employee well-being, and nothing more important than mental health as part of it. And we work with great partners like those on this call, like Dallin Allred, who you'll hear from shortly, who do a fantastic job with providing resources in the workplace. We are particularly good at measuring what matters, measuring the prevalence of mental health within your company. We work with some of the best companies and NGOs in the world. And so since Clint's call in the last 24 hours, we've created a program where, for anybody within the reach of Silicon Slopes, anybody listening here, we will help you measure for free what matters. The prevalence of mental health issues within your organization. And so first one's on me. I'll put my contact information, my cell phone and email in the call. And please reach out, because we can't survive this without banding together, and as employers, to take our rightful place in providing value-based care to our employees and to those that are precious to us. Imagine the health, the productivity, the reduction in cost, the life satisfaction, the lives saved if, as employers, we pony up and fight this fight together. Thank you.
Alan, thank you so much for sharing what you shared. What an important message about taking our masks off. And appreciate you doing that on this call. And to the folks of the Silicon Slopes community, it means a lot. We'll make sure that everything you shared gets out there. Next, we'll go to Dallin Allred, who is the CEO of Tava Health. Please tell me it's not Tava.
Sorry, Clint, the sound cut out. So just give me a thumbs up or cue me when you want me to
go ahead.
start talking.
We're ready for you. I just think I probably screwed up your name, because I screw up everyone's name. Not Dallin Allred. I know how to say Dallin Allred. But is it Tava Health or Tava Health?
It's Tava Health, but we'll answer.
I can't remember what I said. I can't remember what I said. I guarantee I said something wrong. Dallin, take it away.
Not much appreciated. Thanks, Clint. I guess quick background on Tava. We started in 2019, just before the COVID-19 pandemic, with a thesis of helping clinicians and employers basically connect and add a fourth pillar of mental health benefits to their roster of benefits. So you've got your health insurance, your dental insurance, your vision insurance. And this would be your mental health insurance. And this is in response to personal experience, but also, more specifically, as a native of Utah, seeing some of the same statistics that Dr. Insler called out earlier. Utah has the 48th worst level of access for adult mental health resources. And our average state wait time is about 41 days before you can get in to see a licensed therapist. Only about 44% of the therapists in Utah accept insurance at all. And so Tava exists to help people more easily and meaningfully connect with licensed mental health clinicians, counselors, therapists. We do this in two ways. One is by partnering with forward-thinking employers who wanted to add that benefit to their employees, and some will just pay for it out of cash flow and self-insure. Others will use their existing health insurance benefits to cover some of that cost. But one of our newest initiatives, as a way of improving access, we launched in July. And it's basically where we took all of the software that we had been building over the past 4 years and have been using to connect therapists and employees. And we began giving it away for free to licensed mental health clinicians within the United States. We just launched this in July. We've had hundreds of therapists sign up in just the past month, and they can use our electronic medical record software for free. They can use our practice management software for free. They can even join our insurance contracts, and we'll help cover the medical billing and all of that admin work. It's been really amazing to see. I think one of the potential silver linings of COVID is that so many more people are willing to do things part-time or even remotely. And so a lot of therapists, when they had the access and some of the automation that the software provides, have basically launched their own small private practices using that software, and we're excited to be a part of that. It's not something that we're charging them money for again, but we just wanted to, again, accomplish our company mission of improving access. In fact, so many of these therapists have signed up in the past few months that in the state of Utah, if you wanted to go to our website, there's about 1,000 hours of available therapy within the next 7 days. And that's kind of our commitment, is we want to get you into a therapist if you're looking for clinical care within 1 or 2 business days of you reaching out. So yeah, I appreciate the time, Clint. If anybody knows a mental health counselor, therapist, clinician that's looking to work part-time or is working on launching their own private practice, we'd love to connect and help be part of their career growth and that upward trajectory.
Thank you so much, Dallin. And man, my word, kudos to you for working on a company and a startup that's changing lives in the ways that Tava Health is. Check out Tava Health. And for all the research, we'll make sure we put that in the chat as well. Next, we go to the great Kat Kennedy, who is Kickstart's general partner.
Now I got to live up to that, Clint. So thanks for that pressure. But I just have a lot of gratitude in my heart, to Clint and to everyone at Silicon Slopes for organizing this, but especially to those who have shared their stories, been so open and brave in doing so, both the people who have spoken, but also, as I was watching the chat, for those who are watching and attending virtually. There's so much power in telling our stories and what that does to, one, remove any sense of stigma or shame around it, but also in building community and friendship and just like we are all together in this. I, like Adam, have an executive coach who I get to work with at least once a month, but I usually call him more than that. And every time that we talk, he is on a walk. And so I go on a walk as well. And he lives in California. And luckily, he gets to be by the redwoods. And one of the times where we were talking, he brought up this reality that redwoods never grow alone. You'll never see an isolated redwood. Instead, what you see is redwoods in a grove, and they are massive, beautiful trees, but their roots only go 6 feet deep. So you'll never see a lone redwood because they grow together. Their roots are intertwined and tangled together, and that is how they become so tall, so strong, so beautiful, is through community. And just like the redwoods, we humans rely on each other. And, I asked some of my friends as I was hopping on this, like, what could I say that could be useful? And one of them brought up that they have a 2 a.m. club. It is an agreement that they have both for others and that others can rely, that they can call on. At 2 a.m., if I need you, you're putting on your slippers, you're driving over no matter what. So if I need you, I'm going to call, and I know I can rely on you. It's my insurance policy to never be alone if I find myself in an isolated moment. So I love that picture of the redwoods. I love that idea that we are all in this together. Not just going through similar experiences, but that requirement to support each other, to be there. And so I would just, end my portion of this with the call to action of, who is your 2 a.m. club? Do you have someone you can call if you get to one of those moments where you feel so isolated and afraid and ready to do something drastic, you need someone to call, and you need to let them know that they're your person. And are you that person for one or many people? Because we all need to be. So I would have those conversations with the right people as soon as possible. And if we're lucky to be leaders in organizations, you see the power in telling the stories and being open and brave and vulnerable in that sharing. So who's your 2 a.m. club? Who can you be that for? And share your story. There's so much power in it. And once again, thank you to Clint.
Thank you so much, Kat. What an ingenious idea, this 2 a.m. club idea. I feel like we need to get that rolling. That's beautiful. Next, we'll hear from Chris Deaver from Brave Corps.
Thanks, Clint. And thank you, everybody, for sharing your experiences, your stories. And Kat, I love the analogy of the trees, the redwoods. So powerful. We're all interconnected. With Brave Corps, we do coaching for executives, and we've worked with leaders in Silicon Valley and companies like Apple and Pixar, other places. And sometimes we think, wow, these people are untouchable. They don't have these experiences that we do. They do. And in Silicon Slopes, leaders we work with, founders, we're all people. We're all human. We have our struggles. We have our challenges. We all have our valleys. I know I've had them myself. And, part of that is, we live in this kind of baseline existence of, in this world of, there's fear, right? It's conscious, subconscious. We all experience some version of that every day. And what we find ourselves doing, and what the Western world has taught us is, and this is good, we've talked a lot about this today, is being brave. And there's so many people on this call who, and I'm sure those who join us that are so brave and have experienced really difficult challenges in their lives and are being brave. And I heard something too that we shared about, that it's not about competition, and the future is not. We've been taught, we've been told that being a shark, sharkiness, building your empire, all these things are good, and they're not. Really, that leads to silos, and that leads to more loneliness. We've seen with the pandemic, before the pandemic, there was already a mental health crisis, right? People were saying there were 70% of people disengaged with their work. People were struggling already. We can only imagine what those numbers are now. It's, people are feeling it, and we all are. There's a quote from Peter Thiel. He said, set your 10-year plan and go after it and accomplish it in 6 months. But the interesting thing is, with the pandemic, we've kind of had our 10-year plan handed to us, and change is happening all the time, and it feels overwhelming. And on an emotional level, many of us have lost loved ones. We've had personal struggles, whether it's in our families, maybe a divorce, and business struggles, right, with what's going on. And there's also all this technology that's emerging that feels overwhelming. And the answer, we feel strongly, in most of us, this kind of, in this community, there's this drive towards being entrepreneurial, and it's good. It's good to be brave. But when we're brave alone, we can only get so far, and there's limits to that. And instead of the shark analogy, at Brave Corps, we think about the dolphins and how we can partner together, be collaborative. And what Kat was talking about with the trees, that there's an interconnected ecosystem. And so it's not just about being brave alone to break out of fear. It's about being brave together. And the leaders that do this are going to, you're going to lead the future. This is the future. It's not as much self-made as it is shared. And we've explored ways to do this, simple principles in our lives. And I love the 2 a.m. Call, practical approach to that. And the other question is who is your support system? Your brain trust, this group that you can lean on in challenging times. We've explored that. We wrote a book. It's called Brave Together. And it's really about this idea. One of the principles that we really hone in on is about co-creation. And in the workplace, sadly, we design cultures that are not designed to do the things we're talking about. They're not really filled with hope. And so it's incumbent upon us to build more intention in cultures, build places that people love, places where we want to be, we want to experience something. We've brought many of us have brought our work home with us. Literally, we're on calls. We're either hybrid or sometimes fully remote, and so we're having experiences that we invite work into our homes. And so the opportunity really is to, as leaders, build culture and build connections with people. Send those texts, take the time to check in, do a one-on-one, and ask, genuinely how somebody's doing, what's going on in their life. And these things, as small as they are powerful. I felt them. Many of the people on this call have shared, it was a text or a simple reach out, and how powerful that was for them. When we felt that, I've experienced it. It seems like a small thing, but it is so powerful. And we're in this together. And I'm excited by what feels like a movement. We have a lot of people that, and a lot of folks that could be on this call or that are listening in, that have your story, and you're involved in, moving the world forward in these ways, and being brave together with others. And just really simply, I think, in terms of co-creating with others, there's very practical ways we can do this. It's, I think, really finding ways to connect. Send that text. Don't second guess, right? If you feel like you've really got to just reach out, make that call, right? There's somebody who needs to hear your voice. So connection. Another one is collaboration, right? Build that into what you do, right? Make it a pattern in your work, and find ways to collaborate. You can set aside time, right? An hour a day. The best teams in the world, the people that, are looking for not just building the best products or services, but how do you build the best experiences in life, and ways that we can help each other hope again. Build that time into your schedule, right? And make it, maybe it's an hour a week, and you just find those people you want to connect with, and you talk about things that are on your mind. And, it's kind of egos off the table, building blocks on the table. And we're working together towards a North Star of building something in our lives that's better than it was. I've seen this work in so many contexts. And then the third one is just really being powered by principles, and looking at ways that we can look at time-honored ancient wisdom and meditate, right? That's one, is just look at how you can zoom out, step away from the fray. We get so distracted by so many things in this world, and we don't have to be overwhelmed by it, right? Things can be much more simple. We can focus and simplify our lives, go out in nature, to take a break. And I heard something about power breathing, right, today. That's also powerful. But find ways to co-create with others, and be intentional about that. And I'll just add that, we've been taught or told in the world that, no pain, no gain, right? These ideas of just, it's out hustle, right? Optimize everything. You're right down to every single minute or second of your day. And that's not really the best way for us to live a peaceful life. Really, the future is about co-creation, and we can build things better with others, and finding ways to do that calm our souls and are more of an ecosystem, and more like the trees, right? We have this network that goes under the roots. And the thing about those trees is that it's unseen. And so what are those unseen connections we can build in new and different ways and explore together? I think those are the things that become the magic that we've been talking about. So grateful to be here with all of you. And our website's bravecore.co. We've got some resources there that are free. You can find, and some other things you can get access to. But love this conversation. Thanks for organizing it, Clint. Good to be here.
Thank you, Chris. I really appreciate it. Again, Brave Core. Make sure you check that out. I love this idea of small things having an impact. And it's making me think of my friend Joe Tuiani, who was driving his two daughters to a basketball game, to kind of one of their local like city league basketball games. And it was a normal, I think it was like 9 a.m., normal Saturday, hectic, all this type of stuff. And they're going over an overpass to get to the school that they're going to play in. And they see a man on top of the fence about to jump. And Joe immediately pulls over and slowly starts walking towards this man. And he says 4 words over and over again. He says, I love you, bro. I love you, bro. I love you, bro. 4 words. Think how simple that is. And he got him to get down, and he saved that man's life. And he actually has a foundation now called I Love You, Bro. And we'll bring him into these conversations as well. I want to end this by saying I love all of you. Thank you all for joining this community. It means a lot to, be able to organize something like this on such short notice with such wonderful people. Utah is very special in this way. And today is just the start. This town hall is just the start of Silicon Slopes' efforts on this particular issue. And I hope we work together on it and make a real difference. So thank you all for joining. Thank you all.
Thank you.